45 years old. I own an accounting firm as my profession. I am a father of 14-year-old twins now, 14-month-old twins. I'm married to my wife, Lisa. And yeah, the reason why I came down here specifically was for my back injury. I have herniated discs all the way up from my L1, 2, 3, 4, and 5. And it was just basically, how did I get there? I don't think it was just one thing. It was a compound of, I was a CrossFit athlete for almost a decade, coached competitive competitions, and that was maybe the beginning of it. Part of my motivation and overall my twins, my 14-month-old twins. When I get home from work, I see the kids bending over, Daddy, pick me up, you know. So I have to get it fixed. So that's one of the reasons why as well. My first episode probably about 5 or 6 years ago. Yeah, and just progressively getting worse.
Have you done anything before to approach this situation?
Not really, just physical therapy to stems, or not stems, but TEMS, the little pads, electric pads. That's pretty much it. There's not really much you can do. It's just try to work around it, and I'd be good for a few months, and then something re-injure it, and I'd be down for a few weeks. And it's a cycle just going through, and it's going through. I just got tired of it. So what made you decide between Western medication and stem cells? Yeah, good question, because I seen my doctor, who we prepped the MRI through, and I said, okay, well, he's like, this is what's going on. You have herniations and you're L4, L5 at the time, and he said to me, well, there's not really much you can do. He said, I can give you cortisol shots whenever you get in pain. I prescribe you pretty much anything you need. And I said, well, that's it? It's like, well, surgery, but it's just something you're just gonna have to manage for the rest of your life. And then I didn't want to take that as an answer to me. So I started doing my research, and I found BioXcellerator through YouTube. And I watched the Matt Hughes story. I said, wow, that's very interesting. And then I started, educating myself about it and learning a little bit more, and just finally just studying up for hours and hours of going through, how the United States process works, where, they're only allowed, the laws changed. Well, you're only allowed 100,000 stem cells at the time, and they're being shipped into the country, and just by the time they got here, they're pretty much dead. And then they changed the laws, and they said, okay, now you can only use your stems from your hip or your fat. And thinking, okay, well, I'm 45 years old. I don't know if the quality is going to be that well. And then, BioXcellerator came around and explained the process to me.